Cancer by Larley,
Hovig, Arissian,
Linqui.
Group 15. Why is cancer a problem and why is it important? Cancer is a large problem to public health, as it is the second highest leading cause of death in the US. As for the importance, it's a chronic and acute disease. This means that there aren't as many treatments as there are new cases. What is cancer? Cancer is about a controllable cell growth in the body. It could be anywhere. And as of the types of cancer, it ranges from leukemia to cardiovascular. Cancer epidemiology rates of different populations. The epidemiology of cancer is tumors identified in the population. Epidemiologists, they research incidence rates, mortality, prevalence, and how cancer is developed, as well as levels of prevention and treatment. The ACS states that white population for incidence rates is lower than it is for the black population, but mortality rates for the black population is higher than it is for the white population. Who does it affect? What are the risk factors of cancer? Cancer affects mostly older people. The main risk factors are UV rays, smoking, being overweight, alcohol intake, and etc.
There we go. Public health interventions at the local level. Here's an example of a local level intervention, which is a general study done in local areas to determine if some policies made it more feasible to reach nutrition goals. There were 21 policies tested in 5 domains in the test listed below, and they would rate it by 5 very effective or 1 not effective at all. So here's the results. The mean score said they were around 3.5, which said that the policies didn't make it feasible or infeasible. And based on the results, it was perceived that the governmental policies were more effective in finding nutritional goals feasible. So because of that, here's some list of governmental policies that make it more feasible. The Nutritional and Physical Activity Program, CalFresh Program, the CACFP, and the CNP. Here are the data compiled. And the public health interventions at the state level. Here's an example with the California Neighborhoods Data System, which basically was a system that analyzes the association between the socioeconomic status in the specific neighborhood and the incidence of cancer linked in that neighborhood. And this was data compiled over a large database, and it was put into the California database system, which is very helpful for us, which is a very good intervention that the California system made. And here is the public health intervention at the federal level, which is the Ottawa Charter for Health Promotion, which was held on November 1986. And it was an international conference on health promotion, and they wanted to promote health. And there was 5 essential actions that they thought would improve health and improve cancer rates, which was building healthy public policy, creating supportive environments, strengthening community action, developing personal skills, and reorienting health services. And there are available screening and treatment for cancer. There is different screenings which basically catch cancer early, and we could treat it quicker and more effectively. And there are treatments for cancer such as surgery, chemotherapy, radiation therapy, and hormone therapy. Are we on the right track? Yes. And as time goes by, our technology will become more advanced and the treatments will become more effective.
Public awareness of cancer is increasing. And the CDC and NIH both have data on cancer. And there are also a lot of visualizations tools that they do, which shows the prevalence of cancer in the United States. In fact, October is Breast Cancer Awareness Month, and every October people wear pink to demonstrate awareness for one of the most common cancers in women. Public health practitioners look for risk factors that predispose a person to cancer with the goal of preventing the development of cancer. And for breast cancer, doctors look for early signs using screening programs like mammography. Cancer treatments are not widely available. People actually have to go to hospital to seek for cancer treatments. Despite this, there are still a lot of misconceptions about cancer, and some people think that being diagnosed with cancer means the end of their life. While this might be true for some types of cancer, most types of cancer are treatable if diagnosed in early stages.
Here are our references.
Thank you so much.